Mechanical ventilation is definitely the most difficult section of the TMC exam. With that being said, it's also the most important because it's the section with the most questions. That means you will see more questions on this topic than any other. And it's really not even close. This is why we always recommend for students to spend most of their time and energy focusing on mastering mechanical ventilation for the TMC exam. So, if you're ready to boost your knowledge of mechanical ventilation to the next level, let's go ahead and dive right in. Number 1. While assessing a 64-year-old patient receiving volume-controlled ventilation, you note that the peak airway pressure has decreased from 52 to 32 centimeters of water pressure. There have been no other changes to the ventilator settings. Which of the following actions would be appropriate at this time? A. Increase the volume setting until the pressure equals 52 centimeters of water pressure. B. Increase the flow setting until the pressure equals 52 centimeters of water pressure. C. Check for increased secretions and suction if needed. D. Check the circuit for system leaks. The correct answer is D. Check the circuit for system leaks. When you see a major drop in peak pressure, the first thing you should check for is a leak or disconnection and correct it as soon as possible. You wouldn't just want to blindly increase the volume or flow setting without first knowing what caused the peak pressure to drop, and increased secretions would increase the peak pressure, not decrease it. So by using what we know about peak pressure, as well as the process of elimination, you can easily interpret that the correct answer has to be D. Check the circuit for system leaks. Number 2. The physician calls and asks you to select a mode of ventilation in which you can maintain a precise I-E ratio. Which of the following modes would you select? A. Synchronous intermittent mandatory ventilation. B. Control mode ventilation. C. Assist control ventilation. D. Pressure support ventilation. The correct answer is B. Control mode ventilation. In order to maintain a precise I-E ratio, you need to be able to set a mandatory rate and tidal volume. Control mode ventilation is the only possibility of the 4 choices that will allow you to do that. So, you should know immediately that it is the correct answer. In CMV, the patient cannot trigger any breaths. All ventilatory support is provided by the machine. And, as we stated, it can't be any of the other answer choices. So, you know that the correct answer has to be B. Control mode ventilation. Number 3. A 63-year-old female patient is receiving pressure-controlled, assist-control, mechanical ventilation. Which of the following changes would occur if her compliance were to decrease? A. Her delivered volume will decrease. B. Her peak pressure will increase. C. Her inspiratory time will increase. D. Her PEEP level will decrease. The correct answer is A. Her delivered volume will decrease. To get this one correct, you must have an understanding of lung compliance. You also have to take into account that the ventilator is in the pressure control mode, which means that the pressure is preset. If there is a decrease in lung compliance when the ventilator is operating in the pressure control mode, the machine will continue delivering a constant pressure. But, since the lungs don't expand as much when there is decreased compliance, it reaches the set pressure limit much faster. That means that there will be a decreased tidal volume. In this case, the inspiratory time will decrease and the PEEP levels should not be affected. So the correct answer has to be A. Her delivered volume will decrease. Number 4. Your patient is receiving volume control, assist control ventilation. you notice that she has become agitated and her end tidal CO2 has decreased from 38 to 27 torr over the last 3 hours. Which of the following is most likely the cause? A. High body temperature. B. Increased ventilation. C. Increased cardiac output. D. Main stem intubation. The correct answer is B. Increased ventilation. Since we know that this patient is agitated, we can determine that the most likely cause of the decrease in end tidal CO2 is hyperventilation. Treating the cause of the agitation would most likely restore her ventilation back to normal and thus normalize end tidal CO2 as well. A fever would increase her metabolism and would tend to increase the expired CO2 levels, and a main stem intubation would have no effect on capnography readings. So, we know that there can only be one correct answer, and it's B, increased ventilation. Number 5. An intubated adult 69-year-old male patient with a severe obstructive airway disease requires support via mechanical ventilation. Which of the following capabilities would be most important in selecting a ventilator for this patient? A. Approved for the use during MRI procedures. B. The ability to compensate with tube flexibility. C. The ability to run on 12-volt battery power. D. A variable flow control and adjustable IE ratio. The correct answer is D. A variable flow control and adjustable IE ratio. Let's break this one down. Being approved for MRI procedures has nothing to do with a patient with severe COPD, so this one is irrelevant. The ability to compensate with tube flexibility, that literally doesn't even make sense. And the need to run on a 12-volt battery, that one doesn't make sense either. The ability to control the flow and IE ratio will allow you to make sure that the expiratory time is sufficiently long to prevent air trapping and auto PEEP. So, we know that the correct answer has to be D, a variable flow control and adjustable IE ratio. Number 6. A post-operative patient using an IPPB has an inspiratory time that is prolonged, and the machine does not cycle off without an active patient effort. What should you do in order to correct this problem? A. Increase the control pressure. B. Decrease the sensitivity setting. C. Check for a leak in the circuit or mouthpiece. D. Switch the unit to 100% source gas. The correct answer is C. Check for a leak in the circuit or mouthpiece. When it comes to an IPPB, when the machine doesn't cycle off, the first thing you should check for is a leak in the circuit or near the mouthpiece. Decreasing the sensitivity would only make it more difficult to trigger a breath. Switching to a 100% gas source is irrelevant. And increasing the pressure would make it even more difficult for the machine to cycle off. So we know that there can only be one correct answer, and it is C. Check for a leak in the circuit or mouthpiece. Number 7. You are called to increase the expiratory time of a patient receiving volume control ventilation without altering the minute ventilation. Which of the following settings would you adjust in order to fulfill this request? A. Rate of breathing. B. Inspiratory flow. C. Tidal volume. D. trigger sensitivity. The correct answer is B, inspiratory flow. We know that adjusting the rate or tidal volume would alter minute ventilation. So we can rule those two out right away. On most ventilators operating in the volume control mode, expiratory time is not set directly, but is dependent on other settings. Essentially, expiratory time depends on the rate, volume, and flow settings. But since we already ruled out rate and tidal volume, we know the correct answer has to be inspiratory flow. Adjusting the sensitivity would only affect the expiratory time if it were in a full control mode, but this would also affect the minute ventilation. Therefore, we can rule that one out as well. So, by using the process of elimination, we know that the correct answer has to be B, inspiratory flow. Number 8. You are called and asked to decrease the PaCO₂ of a patient receiving high-frequency oscillation ventilation. Which of the following settings should you adjust? A. Increase the frequency. B. Decrease the bias flow. C. Increase the power or amplitude. D. Increase the mechanical dead space. The correct answer is C. Increase the power or amplitude. To get this one right, you must have an understanding of the settings for high-frequency oscillation ventilation. In order to decrease the patient's PaCO₂, you need to increase the tidal volume, and you can do that by increasing the amplitude setting on the ventilator. Increasing the frequency in high-frequency oscillation ventilation would actually cause the PaCO₂ to increase because it would lower the tidal volume. Remember, high-frequency oscillation ventilation is different than conventional ventilation. We can immediately eliminate B and D because decreasing the bias flow and increasing the mechanical dead space would not help to decrease the PaCO₂. So we know that the correct answer has to be C. Increase the power or amplitude. Number 9. A 53-year-old female patient with COPD is receiving volume-controlled, assist-control ventilation. Rhonchial fremitus is felt over the central airways, and wheezing is heard over all lung fields. She has very thick secretions, and her peak pressure is 45 centimeters of water pressure, and plateau pressure is 20 centimeters of water pressure. Which of the following would be useful to treat this patient's condition? A. Cromolyn sodium. B. Triamcinolone. C. Levobuterol. D. Pancuronium. The correct answer is C. Levobuterol, aka Xopenex. By taking the information that is given in the question into consideration, we can determine that bronchospasm is the most immediate problem, which should be treated with a bronchodilator. Rhonchial fremitus also lets us know that the patient has thick secretions and that it is what is causing an increase in airway resistance, PEEP, and plateau pressure. So with that said, a bronchodilator and possibly a mucolytic like acetylcysteine are indicated for this patient. Triamcinolone is a corticosteroid. Pancuronium is a neuromuscular blocking agent, and cromolyn is a mast cell stabilizer. Levobuterol, aka Xopenex, is the only bronchodilator of the choices, so we know that it has to be the correct answer. The correct answer is C. Levobuterol, aka Xopenex. Number 10. A 58-year-old post-operative male who weighs 172 pounds, is receiving volume control, assist control ventilation, at a rate of 14 breaths per minute with a tidal volume of 650 milliliters and an FiO₂ of 40%. You collected an ABG sample and obtained the following results: pH of 7.51, PaCO₂ of 30, bicarb of 23, base excess of -1, PaO₂ of 117, and an SaO₂ of 99%. Based on this information, you should recommend which of the following: A. Discontinue mechanical ventilation. B. Administer IV bicarbonate. C. Increase the peak flow setting. D. Decrease the minute ventilation. The correct answer is D. Decrease the minute ventilation. The first thing you need to do is interpret the ABG results, which tell us that there is an acute respiratory acylosis. As we can see, the PaCO₂ is low, so to correct this problem, we need to elevate the PaCO₂. And to do so, you must decrease the minute ventilation. To take it even further, you can use the patient's ideal body weight to figure out that the tidal volume is set appropriately. So the only other way to decrease the minute ventilation is to decrease the rate. None of the other answer choices make sense in this situation. So we know that the correct answer has to be D. Decrease the minute ventilation. Number 11. A 51-year-old asthmatic patient is struggling to initiate inspiration on a mechanical ventilator that is operating in the assist control mode. Which of the following settings would you first check in order to resolve this problem? A. Tidal volume. B. Pressure limit. C. Sensitivity. D. PEEP. The correct answer is C. Sensitivity. To get this one correct, you obviously need to have a basic understanding of ventilator settings. If a patient is struggling to initiate inspiration while being ventilated in the assist control mode, you should automatically think that the sensitivity setting is set incorrectly. Ideally, you should use the least amount of sensitivity or negative pressure possible to trigger the ventilator into the inspiratory phase. However, sometimes the patient will need a little more help, so you may need to increase the sensitivity in this case. None of the other answer choices will help the patient initiate a breath, so you know that the correct answer has to be C. Sensitivity. Number 12. You are called to assess a patient receiving mechanical ventilation, and you suddenly notice the simultaneous sounding of the high pressure and low volume alarms. What is the most likely cause of this problem? A. There is a disconnection in the ventilator circuit. B. There is a leak in the ET tube cuff. C. There is a mucus plug in the ET tube. D. The patient has developed pneumonia. The correct answer is C. There is a mucus plug in the ET tube. To get this one correct, you must have a basic understanding of ventilator modes and settings, which is why you should spend a lot of time on this section when preparing for the TMC exam. Since the patient is receiving volume control ventilation, a high pressure and low volume condition tells us that an obstruction is present. Only one of the answer choices would cause an obstruction, and it's a mucus plug in the ET tube. A leak or disconnection would cause the low volume alarm to sound but would decrease the PIP. which means the high pressure alarm would not sound. And developing pneumonia would not cause any sudden alarms. So we know that there can only be one correct answer, and it's C. There's a mucus plug in the ET tube. Number 13. Which of the following is true regarding the synchronous intermittent mandatory ventilation mode of mechanical ventilation? A. Machine breaths cannot be pressure controlled. B. The patient contributes to minute ventilation. C. Asynchrony is prevented during machine breaths. D. Only partial ventilatory support can be provided. The correct answer is B. The patient contributes to minute ventilation. To answer this one correctly, obviously you must know about the SIMV mode of ventilation. SIMV allows the patient to take spontaneous breaths between the machine breaths. This means that they have an effect on the rate of breathing and do not contribute to the total minute ventilation in this mode. SIMV provides full ventilatory support at normal rates and partial support when the rate is set lower. Machine breaths can be pressure controlled, and asynchronous breathing still can occur during machine breaths. So, with that said, we know that the correct answer has to be B. The patient contributes to minute ventilation. Number 14. A 63-year-old male patient with a tracheostomy is being mechanically ventilated in the ICU. When the patient was coughing, blood and secretions were blown back into the circuit. What action should you take at this time? A. Flush the blood out of the circuit with normal saline. B. Sedate the patient to prevent more coughing. C. Nebulize a local anesthetic to reduce surgical pain. D. Replace the circuit with a new one. The correct answer is D. Replace the circuit with a new one. Please remember, according to the AARC, you should only break a ventilator circuit when it is visibly soiled. So, in this case, the patient coughed blood and secretions into the circuit, which means that it is visibly soiled and needs to be changed out with a new circuit. There is no indication to sedate the patient or provide a nebulized local anesthetic. So, we know that the correct answer has to be D. Replace the circuit with a new one. Number 15. In order to initiate weaning, you change the patient from volume control, assist control ventilation, to pressure support. After 30 minutes on pressure support, the high respiratory rate alarm sounds, with the patient breathing at a rate of 25 to 30 breaths per minute. What change should you make to the ventilator settings? A. Increase the pressure support level. B. Increase the high pressure alarm to 50. C. Increase the high rate alarm to 30 to 35. D. Switch the patient back to volume control, assist control. The correct answer is C. Increase the high rate alarm to 30 to 35. This one is tricky because at first glance, you probably read the question and thought that the patient is breathing way too fast. But keep in mind though, during weaning procedures, it's normal for there to be a modest increase in respiratory rate. This is common and generally should be tolerated up to a maximum of 30 to 35 breaths per minute. In this instance, the high respiratory rate alarm should be increased to 30 to 35 breaths per minute. It's not uncommon to increase the pressure support level in a situation like this. But since this question doesn't give you the pressure support level, you can't be sure. So, you know it's not A. And you wouldn't want to increase the high pressure alarm. That really doesn't even make sense in this situation. So, we know that the correct answer has to be C, increase the high rate alarm to 30 to 35. Number 16. After intubating a patient, you were asked to confirm proper tube placement. Upon auscultation, you note that the breath sounds are absent on the patient's left side. Which of the following is the most appropriate action to take at this time? A. Obtain a stat chest radiograph. B. Withdraw the endotracheal tube by 1 to 2 centimeters. C. Re-intubate the patient. D. Insert a large bore needle in the left upper chest. The correct answer is B. Withdraw the endotracheal tube by 1 to 2 centimeters. The reason you don't hear any breath sounds on the left side is because the ET tube was pushed too far down into the trachea, and it slid into the right mainstem bronchus. In this case, you should deflate the cuff and pull back on the tube 1 to 2 centimeters and reassess the patient's breath sounds. If you hear bilateral breath sounds at this point, it confirms that the tube was inserted too far but is now in the correct place. There is no need to re-intubate the patient, and you do not need to insert a large bore needle. A chest X-ray is helpful for confirming tube placement, but in this case, the first thing you should do is pull back on the tube. So, by using what we know about the intubation procedure, as well as the process of elimination, you know that the correct answer has to be B. Withdraw the endotracheal tube by 1 to 2 centimeters. Number 17. While monitoring a patient during a spontaneous breathing trial, which of the following observations would indicate that you need to stop the trial and return the patient back to full ventilatory support? A. An increase in heart rate from 96 beats per minute to 114 beats per minute. B. An increase in respiratory rate from 17 breaths per minute to 27 breaths per minute. C. An increase in arterial PCO2 from 44 to 52 torr. D. A decrease in oxygen saturation from 92% to 83%. The correct answer is D. A decrease in oxygen saturation from 92% to 83%. The indications of a failed spontaneous breathing trial include the following: inadequate gas exchange, an increase in PaCO2 greater than 10, unstable hemodynamics, unstable ventilatory pattern. During a spontaneous breathing trial, it's normal for a patient's heart rate and respiratory rate to increase. In this case, however, it's not a big concern because the heart rate stayed below 120 beats per minute and the respiratory rate stayed below 30 breaths per minute. The PaCO2 increased as well, but again, not enough for there to be a huge concern. The oxygen, however, dropped significantly, enough to immediately stop the spontaneous breathing trial and return the patient back to full ventilatory support. So we know that the correct answer has to be D, a decrease in oxygen saturation from 92% to 83%. Number 18. You are attempting to wean an alert intubated patient using CPAP with 40% oxygen. The patient's respiratory rate increases from 23 to 30 breaths per minute, and you notice accessory muscle usage during the weaning attempt. What should you do at this time? A. Return the patient to full ventilatory support. B. Increase the FiO₂ to 50%. C. Apply 5 to 10 of pressure support. D. Extubate the patient and reassess. The correct answer is C. Apply 5 to 10 of pressure support. Remember, when weaning patients from ventilatory support, it's common to use CPAP with pressure support. So, in this case, before terminating the breathing trial, your first action should be to add pressure support to assist with the patient's breath, which will lower the respiratory rate and decrease the need for accessory muscle usage. There is no indication for the need to increase the FiO₂, and you wouldn't want to extubate yet because the patient has not passed the spontaneous breathing trial at this point. So we know that the correct answer has to be C. Apply 5 to 10 of pressure support. Number 19. You have a patient that is receiving ventilator support in the volume control mode when suddenly the high pressure alarm begins to sound. Which of the following would you select in order to fix this problem? A. Increase the flow. B. Increase the pressure limit. C. Suction the airway. D. Remove air from the endotracheal tube cuff. The correct answer is C. Suction the airway. For the TMC exam, you must know the common reasons that would cause the high pressure alarm to sound. We actually cover this topic extensively in our Hacking the TMC Exam video course. But just know that some of the common reasons include an obstruction or mucus plug, any factor that increases airway resistance or decreases compliance, secretions, and a kink in the ET tube. In this case, after looking at the answer choices, we can see that suctioning the airway is one of the choices. And we know that clearing secretions will decrease the peak pressure back down to the expected level. None of the other answer choices really make sense in this situation, so you know that the correct answer has to be C. Suction the airway. Number 20. While attempting a spontaneous breathing trial for weaning, which of the following changes in the patient's status would be acceptable? A. The SpO₂ falls from 91% to 81%. B. The scaling muscle activity increases. C. The heart rate increases from 97 to 115 breaths per minute. D. The systolic blood pressure decreases from 115 to 76. The correct answer is C. The heart rate increases from 97 to 115 breaths per minute. To answer this one correctly, you have to know the indications of a successful weaning trial. Some of those indications include SpO₂ greater than or equal to 85 to 90%, or a PaO₂ greater than or equal to 50 to 60 torr, pH greater than or equal to 7.30, an increase in PaCO₂ by less than 10 torr, a heart rate less than 120 to 140 breaths per minute, a systolic blood pressure less than 180 to 200 and greater than 90, a respiratory rate less than or equal to 30 breaths per minute, and no accessory muscle usage. So, after reviewing the answer choices, we can see that only one would be deemed acceptable while weaning. An SpO₂ of 81% is dangerously low. Scalene muscle activity means that the patient is using their accessory breathing muscles, which is a sign of respiratory distress. And a systolic blood pressure of 76 is dangerously low as well. However, an increase in heart rate from 97 to 115 isn't anything out of the ordinary. It is typical for the heart rate to increase some during an SBT. So we know that the correct answer has to be C. The heart rate increases from 97 to 115 breaths per minute. Number 21. You have a patient that is receiving mechanical ventilation in volume control mode that is being monitored with a continuous pulse oximeter. While temporarily removing the patient from the ventilator to perform suctioning, their SpO2 drops from 95% to 88%. Which of the following should be done in order to fix this problem? A. Initiate a PEEP of 10. B. Change to a closed system suctioning device. C. Administer a short-acting bronchodilator. D. Perform bedside hemodynamic monitoring. The correct answer is B. Change to a closed system suctioning device. When you have a patient on the ventilator, whenever possible, you should always try to use a closed system suctioning device. Not only does this help to prevent ventilator-associated pneumonia, it also prevents the patient's SpO2 from dropping while removed from the ventilator. PEEP is not necessary in this case, and a bronchodilator is not indicated. Hemodynamic monitoring isn't necessary either. So we know that the correct answer has to be B. Change to a closed system suctioning device. Number 22. Which of the following is the most common problem associated with the assist control mode of ventilation? A. Hypoventilation. B. Hyperventilation. C. The need for neuromuscular paralysis. D. Increased work of breathing. The correct answer is B. Hyperventilation. To get this one right, you have to have a basic understanding of the assist control mode. While in assist control, patients can actually trigger machine breaths at a higher rate than the rate that you set on the ventilator. This can cause the patient to develop tachypnea, which means that they are breathing too fast, aka hyperventilation. This most commonly occurs in patients suffering from pain, anxiety, and other causes of acute distress. Unfortunately, tachypnea in this mode also can cause breath stacking or auto-PEEP, which is definitely something that we want to avoid. None of the other answer choices really make sense in this situation, so we know that the correct answer has to be B. Hyperventilation. Number 23. While performing a routine ventilator check, you note the following settings: an exhaled tidal volume of 550 milliliters, a peak inspiratory pressure of 35, a high pressure limit of 64, a low pressure alarm of 25, and a low tidal volume alarm of 500 milliliters. Which of the following changes should you make at this time? A. Decrease the high pressure limit to 45 to 50 centimeters of water pressure. B. Decrease the low pressure alarm to 10. C. Increase the low tidal volume alarm to 600 milliliters. D. Increase the set tidal volume to 750 milliliters. The correct answer is A. Decrease the high pressure limit to 45 to 50 centimeters of water pressure. To answer this one correctly, you have to have a basic understanding of ventilator alarms. You should definitely spend some time learning about them before taking the TMC exam. For this patient, all of the settings are acceptable, except the high pressure limit. In general, it should be set 10 to 15 centimeters of water pressure above the peak inspiratory pressure. So in this case, it is set too high, which increases the chances of barotrauma or a lung injury. None of the other answer choices make sense in this situation, so we know that the correct answer has to be A. decrease the high pressure limit to 45 to 50 centimeters of water pressure. Number 24. Which of the following is an advantage of the SIMV mode of ventilation over assist or control? A. SIMV maintains respiratory muscle strength. B. SIMV prevents hyperventilation. C. SIMV increases pleural pressures. D. SIMV increases the need for sedation. The correct answer is A. SIMV maintains respiratory muscle strength. This one is simple as long as you know the difference between SIMV and assist control ventilation. Each mode of ventilation has advantages and disadvantages over one another. One major advantage of SIMV is that it requires the patient to do a lot of the work, so it helps to maintain respiratory muscle strength and avoid muscle atrophy. Assist control provides full ventilatory support, but also allows the patient to control the frequency by taking additional breaths, meaning that hyperventilation can sometimes be an issue. SIMV does not prevent hyperventilation, nor does it increase the pleural pressure or increase the need for sedation. So that means we know that the correct answer has to be A. SIMV maintains respiratory muscle strength. Number 25. Your patient is intubated and is receiving positive pressure ventilation. You should strive to keep the patient's plateau pressure below which of the following in order to prevent barotrauma? A. 20 centimeters of water pressure. B. 30 centimeters of water pressure. C. 40 centimeters of water pressure. D. 50 centimeters of water pressure. The correct answer is B. 30 centimeters of water pressure. Plateau pressure is obtained by checking the pressure at an end-expiratory pause. In order to prevent barotrauma and the risk of a lung injury, you should try to maintain the plateau pressure below 30 centimeters of water pressure. If the plateau pressure were to increase greater than 30, this is an indication that you should switch the patient from a volume cycled mode to a pressure cycled mode. So, to get this one right, you simply just had to have a basic understanding of plateau pressure. The correct answer is B. 30 centimeters of water pressure. Number 26. A male patient is being ventilated via a tracheostomy in volume control SIMV at a rate of 10 breaths per minute. Upon assessment, you notice that the patient has started to use his accessory muscles during spontaneous breaths. What would you recommend to help this patient? A. Switch the patient to an inspiratory flow pattern. B. Increase the pressure support. C. Decrease the SIMV rate to 6 breaths per minute. D. Switch the patient to pressure control SIMV. The correct answer is B. Increase the pressure support. There's a lot going on in this question, so let's break it down. An increase in the usage accessory muscles indicates dyspnea or an increased work of breathing. This can likely be attributed to the resistance caused by the tracheal airway. You can help the patient overcome this resistance by increasing the pressure support level. If you were to decrease the rate, this would force the patient to take more spontaneous breaths, which would make matters worse. None of the other answer choices make sense in this situation, so you know that the correct answer has to be B. Increase the pressure support. Number 27. What is the most important consideration to make when selecting the initial ventilatory settings for a new patient? A. The type of device that is being used. B. The quality and amount of nursing supervision. C. The patient's size and clinical condition. D. The amount of spontaneous ventilatory effort. The correct answer is C. The patient's size and clinical condition. When setting up a new patient on the ventilator, the first step is to establish the initial settings. For the TMC exam, you must remember that the initial settings are dependent on the patient's size and clinical condition. For example, you can use the patient's ideal body weight in order to determine the initial tidal volume setting. The type of device does not matter in this case, nor does the amount of nursing supervision. So, by using what we know about ventilator settings, as well as the process of elimination, we can determine that the correct answer has to be C, the patient's size and clinical condition. Number 28. After running an ABG sample, your patient that is on the ventilator in SIMV has a PaCO₂ of 60. The physician asks you to correct this problem. Which of the following actions would be most appropriate in this case? A. Increase the frequency. B. Increase the FiO₂. C. Increase the mechanical dead space in the ventilator circuit. D. Decrease the tidal volume. The correct answer is A. Increase the frequency. This is a simple question about making the proper ventilator changes according to the patient's ABG results. This is something that you absolutely must know how to do in order to pass the TMC exam. In this case, the patient is clearly hypoventilating because the PaCO₂ is elevated outside of the normal range. So you can adjust the ventilator by increasing the frequency to blow off some of that excess CO2. There is no indication to increase the FiO₂ or mechanical dead space, and decreasing the tidal volume would make matters worse. So with that said, we know that the correct answer is A. Increase the frequency. Number 29. The physician orders mechanical ventilation in the pressure control, assist control mode for a 55 kilogram post-operative male patient. Which of the following initial settings would you choose? A. A peak inspiratory pressure of 25, a rate of 30 breaths per minute, and an inspiratory time of 1 second. B. A peak inspiratory pressure of 32, a rate of 12 breaths per minute, and an inspiratory time of 2 seconds. C. A peak inspiratory pressure of 40, a rate of 20 breaths per minute, and an inspiratory time of 1 second. D. A peak inspiratory pressure of 25, a rate of 12 breaths per minute, and an inspiratory time of 1 second. The correct answer is D. A peak inspiratory pressure of 25, a rate of 12 breaths per minute, and an inspiratory time of 1 second. In order to get this one right, you must know the normal values for the initial ventilator settings. And, might I add, you definitely must know this for the TMC exam as well. In general, the initial settings for assist control pressure controls are as follows. A peak inspiratory pressure of 20 to 30, a rate of 8 to 20 breaths per minute, and an inspiratory to expiratory ratio of less than or equal to 1 to 2. As you can see, by going through the answer choices, there is only one choice where all the numbers are within the correct ranges. So we know that the correct answer is D, a peak inspiratory pressure of 25, a rate of 12 breaths per minute, and an inspiratory time of 1 second. Number 30. A 54-year-old female patient is receiving ventilatory support in the volume control mode. After performing endotracheal suctioning, which of the following would indicate effective clearance of retained secretions? A. A decreased inspiratory time. B. A smaller tidal volume. C. A lower plateau pressure. D. A lower peak pressure. The correct answer is D. A lower peak pressure. To get this one right, you have to know that retained secretions increases the airway resistance and peak airway pressures during volume control ventilation. So, in order to fix the issue, you have to remove the secretions via suctioning, which will decrease the peak airway pressure. On the other hand, if the patient was in the pressure control mode, you would expect an increase in the delivered volume once secretions are cleared. None of the other answer choices really make sense in this situation, so we know that the correct answer has to be D, a lower peak pressure. Number 31. While assessing a mechanically ventilated patient after brain surgery, the patient has an intracranial pressure of 20, but is otherwise stable. His latest ABG results are as follows: a pH of 7.31, a PaCO₂ of 48, a bicarb of 24, a PaO₂ of 88, and an SpO₂ of 95%. Based on this information, which of the following should be done at this time? A. Increase the minute ventilation. B. Add 10 of PEEP. C. Decrease the tidal volume. D. Maintain the current settings. The correct answer is A. Increase the minute ventilation. The first thing you have to interpret is that the patient has a higher than normal intracranial pressure. Remember, the normal range for intracranial pressure is 10 to 12. PEEP is not indicated, and there is no indication to decrease the tidal volume, so we can rule those two out right away. Remember that for patient with a high intracranial pressure, you can actually lower it by purposefully hyperventilating the patient. And since this patient is already slightly acidiotic, with an elevated PaCO₂, hyperventilation could help to lower the PaCO₂ and intracranial pressure all at the same time. So in order to hyperventilate the patient, we need to increase the minute ventilation. So, by breaking this question down and taking everything into consideration, we can determine that the correct answer has to be A. Increase the minute ventilation. Number 32. You have a patient that is intubated and receiving ventilatory support via volume-controlled SIMV. The physician anticipates that the patient will be on the ventilator for another 3 to 5 days. Which of the following actions would you recommend? A. Switch the patient to non-invasive positive pressure ventilation. B. Switch from an endotracheal tube to a tracheostomy. C. Maintain the endotracheal tube in place. D. Switch to pressure control ventilation. The correct answer is C. Maintain the endotracheal tube in place. If a patient is expected to be on the ventilator for less than 1 week, it is best to just continue using an endotracheal tube as the airway for ventilation. This is considered to be short-term ventilation. For long-term ventilation, which generally means 21 days or longer, you want to recommend the use of a tracheostomy instead. There is no indication for non-invasive positive pressure ventilation, nor should you switch the patient to pressure control ventilation. So, by going through all of the answer choices, we can determine that the correct answer has to be C. Maintain the endotracheal tube in place. Number 33. Your services are requested to interpret the ABG results of a 52 kilogram female patient who is receiving volume control, assist control ventilation. The patient has a tidal volume of 400 milliliters, a set rate of 10 breaths per minute, and the FiO₂ is set at 35%. Her blood gas results are as follows: a pH of 7.31, a PaCO₂ of 49, a bicarb of 24, a base excess of -2, a PaO₂ of 74, and an SpO₂ of 95%. Based on the given information, Which of the following changes is appropriate at this time? A. Increase the FiO₂. B. Increase the tidal volume. C. Increase the set rate. D. Maintain the current settings. The correct answer is C. Increase the set rate. First and foremost, you must interpret the ABG results. In this case, the patient shows acute respiratory acidosis. And by looking at the PaO2 and SpO2, we can determine that her oxygenation status is satisfactory. To correct acute respiratory acidosis, we need to blow off some of that PaCO2, and we can do that by increasing the minute ventilation. This means that we need to either increase the rate or increase the tidal volume. The question provides her weight of 52 kilograms and the set tidal volume of 400 milliliters, so we can calculate that the tidal volume is set appropriately. You can do this calculation by saying 400 divided by 52, which approximately equals 8 milliliters per kilogram of body weight. This is within the satisfactory range. Since the tidal volume is set correctly, we know that in order to lower the PaCO2, we need to increase the rate. So the correct answer has to be C, increase the set rate. Number 34. A patient is receiving mechanical ventilation with a PEEP setting of 10. The physician calls and orders you to increase the PEEP to 14. After making the adjustment, there is a rapid drop in the patient's blood pressure and a significant rise in heart rate. Which of the following actions should you take? A. Increase the FiO2 by 10%. B. Lower the PEEP back down to the previous setting of 10. C. Administer sodium bicarb. D. Obtain a stat EKG. The correct answer is B. Lower the PEEP back down to 10 centimeters H2O. To get this one right, you need to remember that an adverse effect of PEEP is a decreased cardiac output. This is clearly what's going on with this patient because the question tells us that there is a rapid drop in a blood pressure and a rise in heart rate. As a respiratory therapist, when there is an adverse response to any type of therapy, your first reaction should be to stop the therapy and restore the patient to their prior state. In this case, it only makes sense to lower the PEEP back down to the previous setting of 10, so we know that the correct answer has to be B. Lower the PEEP back down to the previous setting of 10. Number 35. A 43-year-old 57-kilogram patient is admitted with a suspected drug overdose. The man is unconscious and isn't making respiratory efforts to breathe. The ABG results on a non-breathing mask are as follows: a pH of 7.28, a PaCO2 of 74, a bicarb of 20, and a PaO2 of 315. What should you recommend at this time? A. Apply BiPAP with an inspiratory pressure of 20, an expiratory pressure of 5, and an FiO2 of 30%. B. Intubate and apply SIMV with a tidal volume of 600 milliliters, a rate of 6 breaths per minute, and an FiO2 of 40%. C. Intubate and apply assist control ventilation with a tidal volume of 450 milliliters, a rate 12 breaths per minute, and an FiO2 of 50%. D. Apply CPAP at a pressure level of 10 and an FiO2 of 100%. The correct answer is C. Intubate and apply assist control ventilation with a tidal volume of 450 milliliters, a rate of 12 breaths per minute, and an FiO2 of 50%. First, we must interpret the ABG results. We can see that the patient is in acute respiratory acidosis and needs full ventilatory support. This means that we can immediately rule out the answer choices with BiPAP and CPAP. The SIMV mode at a rate of 6 breaths per minute is only going to provide partial ventilatory support, so we can rule that one out as well. So by using what we know about initiating mechanical ventilation, as well as the process of elimination, we know that the best option for this patient is assist control ventilation at a normal rate with an initial tidal volume of about 8 milliliters per kilogram of ideal body weight. So we know that the correct answer has to be C. Intubate and apply assist control ventilation with a tidal volume of 450 milliliters, a rate 12 breaths per minute, and an FiO₂ of 50%. So there you have it. I truly hope that this information can help you study and prepare for the TMC exam. People often ask me this question: what's the easiest way to pass the TMC exam on my first attempt? And I always give the exact same answer: you practice. It's that simple. You've spent months in the classroom learning all the material and information that you need to know for the exam. Now, you just need to practice answering questions exactly like the ones you'll see when you take the real thing. If you like these practice questions and found them to be helpful, then I have good news. This is only a small sample of what we have for our students. You can check out our TMC test bank, which is loaded with tons of practice questions and explanations. The good news is, we coach each and every topic that you must know for the exam, including more questions on mechanical ventilation. Going through practice questions is by far one of the most effective strategies for preparing for the exam, which is why I always recommend it to all students. Not to mention, I can always tell a huge difference in students who use practice questions to prepare and those who do not. So, if you're interested, you can get exclusive access to our TMC test bank today by going to respiratorytherapyzone.com/TMC. That's respiratorytherapyzone.com/TMC. I wish you the best of luck as you study and prepare for the exam. Keep practicing and working hard, and I know you'll be successful when you take the exam and begin your career as a respiratory therapist. Thanks again for listening, and as always, breathe easy, my friend.